So as I was going through the book, I immediately thought about my parents who are seniors, who have a lot of doctor's appointments and a lot of specialists and a lot of pills. Sometimes they're overwhelmed at what the doctors or nurses say. So for us, our family, the book empowered my parents to be able to say, no, now look, I've read in this book, and before they go to the doctors, Dad had to go to the eye specialist because he's a diabetic and they're going to do laser surgery on his eye. I said, now what questions do you have? Well, I don't know. It seemed that this eye is this or that eye is this. So what we've done is we've refined and written down those questions. And because of that, and referring back to the other books, when they went to the doctor, he was going to give them a dye. Well, my dad's diabetic and he's on dialysis. And just a little bit of research after reading this book has indicated, well, a lot of times that dye's not a good thing for a dialysis patient. So consequently, when the doctor said, well, we're going to give you this dye to see how bad your diabetes is, my dad said, well, I don't know how bad they are, but 80 years old, you didn't put no dye in me. And he says, oh, well, no, Mr. Madden, we'll have to do that. And my dad said, no, because my wife and I found an article that said that this dye is not always good for a person that's on dialysis. Well, it shouldn't hurt you. And my dad said, well, another book said that I can tell you no. And guess what book they had? Lorene Burkhart's book. And so it was no. Dad is not college educated. My mom has an associate's. And so for us, I share that because they felt, well, you know, being 80, well, you know, I don't have an MD, you know, I don't have a PhD. Well, I read it. My dad would say, well, I read well, you know. And so what this has done is it has empowered them and my dad to realize, yes, you do read well. And yes, you may not be very mobile, but he has a keen mind. And because you read well and you have a keen mind, you can help facilitate the quality of life that you are living in your later years. It is not a coffee table book in my parents' house. She literally carries it in a baggie with all their medication. And so if they don't get the results that they think that they should have, she literally pulls this book out and she says, now wait a minute. It's not why would I recommend the book, it's why would I not recommend the book? Because the book is an enhancement of a quality of life for young and old and those in between in a healthcare system that has a lot of twists and turns and a lot of very academic, intelligent people that sometimes forget that there's just the person that's elderly, or just the person that's confused, or just the person that's nervous, and we don't challenge authority. And I think the book says, you're the authority, but this is my life, this is my health, and ultimately I have to make that decision.